Good morning. It is 10 o'clock, so if you want to wrap up your conversations, we'll begin. All right. Good morning. I'd like to call the April 7th, 2014 Human Services Committee meeting to order. I am looking for an approval of the agenda.
So moved, ma'am.
We have a motion and support. Are there any corrections, additions? All in favor of the agenda as printed?
Aye.
Opposed? All right, we'll move forward with this agenda. Public comment. Is there anyone who would like to address the Human Services Board? Public comment? Seeing none, we'll move on to committee items. We have the minutes of our March 10th, 2014 meeting.
Move to approve.
We have motion and support. All in favor say aye.
Aye.
Opposed? All right, the minutes approved as recorded. Other meeting minutes? Oh, I'm sorry, I way moved past that. All right, up first we have the Lifeways. Mary Beth?
Good morning. Right in your packet, you'll find the report for this month, and I also have some updates since I submitted that report, so I'll kind of give those verbally. But to kind of talk about where we are related to the counties and activity, right now we are in the process of having a discussion with Jackson County Facilities about whether or not they might be interested in contracting with us for some additional facilities management types of services, and you'll see that in your packet, which is the group home leases, the leases within the Lifeways nonprofit section of the building, as well as safety officer functions. And there was actually a meeting last week to discuss that, and I don't have the update as to where we are, but we are discussing that, and that would be a support to Lifeways and a collaboration with the county related to facility support. The other thing that we're doing, that we've done is for a period of time as we were transitioning facility support from the county for Lifeways, was that there were two processes in which people submitted what's called help desk tickets, which was an administrative kind of burden for Lifeways because we were putting them into one database and then turning around and then also putting them into the county's process for facility type support, and we have transitioned that over totally to the county. So that's going really well, and that's helped our agency. The other thing related to what's happening with Lifeways at this point in time, we are in the process of our strategic planning. We did a 2-year plan, and now we are convening that process this summer with our board and with the leadership of the organization, and part of the planning for that is doing an environmental scan and having focus groups and seeking stakeholder input. So there'll be a process for individuals if they would like to provide feedback related to future direction of Lifeways in our upcoming planning. The other thing that's happening is we're having in April our annual celebration where we take the time to recognize individuals with disabilities and their accomplishments, their ability to recover from either developmental disabilities or substance abuse or even mental illness, and also taking the time to recognize our provider network and the accomplishments that they have. So that's upcoming in April 17th. The other thing that's happening at this point in time is related to the Mid-State Health Network. And as I've talked before, some of the benefits about Lifeways joining a Mid-State region, while we do have the challenges, and I'll go into that a little bit here in a minute about the general fund and the local, the challenges related to Medicaid is that this is a benefit to us because we're able to regionalize and we've been the poorest funded. They're going to be bringing the bottom up. So they will be taking those poorer funded CMHs and giving additional Medicaid so that we can look at providing services for individuals in Jackson and Hillsdale County that we have not had the luxury to provide. So in your packet you'll see some of the areas in which we're looking at things like respite, diversion services, and also intensive crisis stabilization, and that's a service that helps individuals who are in crisis and prevent them ending up in the hospital. It's a less costly service. So we're looking at that, so that is a benefit. But then again, we do have challenges, and we've talked about that many times, and right now we're at the general fund. And as I spoke last month, we were in the process of trying to get a supplemental bill passed that would put some of those general fund dollars back in to the community mental health as they transition individuals into Healthy Michigan. Where we are, we had a meeting last week with the Department of Budget and with Michigan Department of Community Health. They have put in an additional for the month of April and May of roughly $13 million to be able to adjust as we transition individuals from Healthy Michigan to, from general fund funding to Healthy Michigan. So that's good, and they have been committed. They have indicated that they will monitor the data related to the transition, so they're going to watch the individuals that shift from GF to Healthy Michigan and be able to make adjustments as that happens. You know, that's critical when we look at the fact that we serve, just last month, just some numbers I wanted to share with you. At the front, through our access, we provided 153 crisis interventions. So that's somebody that's in crisis who's called, who may not necessarily need inpatient, but they're in a crisis, and maybe they need just some time to come in and meet with a counselor. We've also provided 295 access screenings in 1 month. And that's for individuals who are at the point of needing some type of services within Lifeways. 79% of those individuals did receive services and referrals in, so it's critical when we look at the fact that many of these are general fund individuals, and we want to ensure that we continue to be the safety net for those in Jackson and Hillsdale County. When we talk about where we're at related to the local match, as you might be aware of, Carl has organized a meeting with myself and with also one of our board members from Hillsdale that represents Hillsdale County Commission, with Mike Shirkey, to talk about local match, because as I've talked about before, Section 428 needs to be removed and not require that burden to be on the backs of the counties. So we are hopeful that that will happen. We are also meeting, that meeting is scheduled for April 14th. That same week, through our association, we're also having a meeting related to Section 428 and trying to really push the advocacy related to having that happen and having Section 428, which would help both counties not to have the community mental health make that local match for the Medicaid drawdown. And that is it for my update. If there are any questions?
Commissioner Shotwell?
You sent a document to us that talked about general funding background for FY 14-15, and as of April 1st, you're going to have a 54% reduction in state general fund. How does that impact Lifeways, and are counties expected to make up that shortfall?
No. How that impacts Lifeways. Now, when I sent this out, this was before they put back in, what I just talked about was they put back in for the month of April $7 million and then $3.3 million for the month of May. So they have put some of those fundings back in. So it's from $23 million a month that the state receives down to $18 million. On a monthly basis, so there's still a gap. What Lifeways has done is really worked with our providers to look at individuals that are currently in service that can be transitioned to individuals in the community. We have worked really hard to also look at state inpatient, individuals that are in the state hospital, and have reduced the numbers from 12 down to 4 individuals. That has a significant impact on general fund dollars. So, you know, we will continue to advocate, and we also have very aggressive efforts as an agency and with our providers to look at individuals currently that are in our GF funding and assist them with applying for Healthy Michigan. The importance about when you look at Healthy Michigan payment, when we receive that, it's going to be similar to the Medicaid payment that we receive, where it's a capitation payment. So you receive a capitation payment for all those who are eligible in your county, whether or not you actually serve them. So the need for us to really work with other community stakeholders, which Allegiance and the Center for Family Health are 2 key players, to enroll all individuals in the county who are eligible is critical. Lifeways is looking at holding an event next week where we will do some marketing and get the word out that come to Lifeways on these dates, and we will assist anybody in the community who would be eligible for Healthy Michigan. It only takes 15 to 16 minutes to apply, and you know immediately, unlike the current Medicaid process.
With ACA coming into effect in Michigan and the cutoff date, but do we make sure that recipients of general fund dollars are signed up for ACA and make sure that they are protected with other health insurance, or at least mental health coverage through other health insurance?
And that's what I talked about, that's what we're doing, is we're looking at the list of all of those individuals, and we've done, prior to knowing that April 1st was coming, we did an analysis of all of those individuals, and about 80% of them, based on their current income level, will qualify for Healthy Michigan. So we are aggressively working to assist them over the phone, going to their house, and applying and completing that application, because we need to shift it out of GF and into Healthy Michigan. Yes.
Commissioner Leitner?
I just have a question in regards to your your projections, I guess.
Yes.
You have on here that for the year, for the first 6 months of 14, that you have spent project to spend 141 million, and there's 65 million left in the second half of the year.
Yes.
So what, I guess, is that all you're going to spend, or are you going to have a deficit again for 2014? Like, why is there such a big difference from the first 6 months to the last 6 months? Are the expenses going to amount the same, or are they pretty consistent on a monthly basis, or where are we going to fall, I guess, for 2014?
Okay. This here is statewide. So this is looking at general funds statewide and does not include expenses. It tells you this is what they're currently funding, this is what the cuts that are going into effect statewide. The thing to keep in mind is what I just mentioned, that we were able to advocate to put some of it back. They have committed to looking at it on a monthly basis to see where the system is related to those individuals shifting over. And if they see that that's not happening as they're projected, because what their projections are based on is 240 million or 40,000 individuals being eligible. As of last week, they had 25,000 individuals that had applied. So there is some concern that maybe, there's going to be a transition. So if they look at it and they see in 2 months at the end of May that there continues to be a need for general fund dollars for the community mental health because not as many people enrolled, they have committed to making some further adjustments for general fund. But this is really just about the state budget related to general fund and not the expense.
Any other comments or questions for Mary Beth? Mr. Leitner?
Yeah.
You had mentioned something about diversion services. Now, is that the same type of diversion services in collaboration with like the court system, or a different type of diversion program?
No, there's different, it is that.
Okay.
We are looking at how we might be able to utilize some of those additional Medicaid dollars, but for that, there would have to be individuals who are eligible for Medicaid. Currently, we are utilizing general fund dollars for some of the jail services that are being provided. Now, if we continue to experience a cut where we're not able to meet the need, we will have to look at the jail services that are being provided utilizing general fund dollars and make a determination whether or not we have the funds to continue to do that.
Just out of curiosity, do you know how many people you have in the diversion program that would be eligible for Medicaid now?
I couldn't tell you that, no. Not off the top of my head, I'm sorry.
Thank you for that report.
All right, thank you.
Next on the agenda, we have Department of Aging Monthly Report. Director Wendell.
Good morning. We have news on the information with regard to federal grant funding. When the federal government shutdown happened in October, in November, the state said, well, cut federal funds by 18%. So we've been waiting, and it still isn't official yet until the Area Agency on Aging Board meeting in April, but I expect over $100,000 to be reinstated of federal funds that previously were reduced. So that's good news. We attended a community event on March 8th called the Women's Expo, and it's the first time that we had staff man an information booth, and it was very successful. We got to talk to a lot of people, and especially potential caregivers that we gave information, and especially our name and number, so if they ever have any questions about what resources are available in the community, to give us a call. So that was a very good way to reach out to the community. Normally in May, we have what's called a senior festival, and that started 35 years ago. It was at Parkside High School at that time, where it was a time for entertainment and also informational tables. And then it really grew under the direction of Pat Spink when she was employed. She's retired a few years ago. And it was held first at Jackson Crossing and then at Westwood Mall. And we've noticed the attendance kind of go down, and an employee group through our high performance organization teams, they're suggesting to try something different, and that's what we'll do this year. And so we won't be having an event at the mall this May, but we will be having something in September, so I'll bring more information later. And at this point, the plan is to have it at the fairgrounds. So I'll let you know. And this Thursday, we have a department-wide training. It will be our third training related to high-performance organizations. We have different educational components of topics that our employees have requested that we have training about, and we'll go over the HPO as it has affected our department since the county first offered the training. I think it was May 2010. And where do we go from here? We're working on a strategic plan incorporating the county's strategic plan, but specific to Department on Aging programs and services. And for our 2014 budget cuts, about last year when we talked about 2014 budget cuts, one of the items we listed was that we have 2 nutrition sites where we pay rent, and our goal was to have one of those sites relocated to a building that we did not have to pay rent. So we thought that we could relocate the site that's at Leone Township from the church that it is in now to the township building, and the township, invited us to come. But when we had the Area Agency on Aging look at accessibility, the restrooms aren't accessible, so we're not able to relocate to that building. And then we contacted 10 other potential locations and were unable to find one. So what we did was negotiate with the current location. Instead of a flat monthly amount, we're paying a certain amount each day that the site's open. So that is saving $920 a year. And so we're still looking at possible locations for the other location where we pay rent. So for this year, we're doing okay cut-wise, not for a good reason though. With all the bad weather we had in January and February, our sites were not open for several days, so that's a cost savings that will help us out as far as our budget cuts for 2014, but we do need to look at long-term changes for after 2014. Any questions?
Marcy, first of all, you made reference to running an event, which is easy just to continue on the same path as you have every year. I was very pleased to hear you say that not only are you listening to your HBO awareness group, that they're willing to step up and make those changes to accommodate in a new manner. Yeah. So that's good. I mean, that just goes to show that the training not only is making a difference, some new initiatives, but you as a director are listening to them as well.
Oh, thank you.
I was very pleased to hear that. Commissioner Rice.
What are you smiling about? I just wanted to refer to the budget cuts and specifically St. Aidan's Church in Leone Township. I'd just like to throw this out there. Marcy and her staff and with some of my, I even threw out some recommendations, but they worked very hard at trying to find a new site, extremely hard for a long period of time to save, and ultimately to save money. And unfortunately, that didn't happen. So Marcy actually went and worked out a better arrangement with the church, so still save some money because that site is highly used by seniors. I've been there many times, and so I really appreciate her and her staff's effort on that, and the fact that we still have a site out there, because like I said, it's, again, we get a lot of seniors out there, so thank you.
Any other comments or questions for Marcy? All right, thank you for that monthly
thank you.
report. Next on the agenda, we have the Health Department monthly report. Health Officer Toon.
Good morning, Commissioners. The county health rankings came out well, I guess it was actually a little bit last week, and I did share a copy of the county health rankings in the information packet with you as well. And while we lost a little bit of ground on the health outcomes rank from 48th to 50th, that's just a slight movement in the wrong direction, but we gained a lot of ground on health factors from 61st to 48th. So we're doing the right things and we're making progress. With respect to the report itself, there were a number of areas of concern that the county health rankings organization suggested we look at. I just wanted to share briefly with you what those were. They highlighted adult smoking, adult obesity, excessive drinking, teen births, the primary care physician ratio in the community, high school graduation, and children in poverty. And we're actually working on in all of those areas, not necessarily directly as a health department activity or initiative, but they're all being worked on in one way or another. The primary care physicians ratio of 2,159 to 1, on an overall top U.S. performer basis, if we were in the 90th percentile, it'd be about half of that at 1,051 to 1. So I have heard since I've arrived in the community that we do have a primary care physician shortage, and this seems to verify that. So we'll continue to work with Allegiance Health on that, and through the graduate medical education program, the residency program, I'm hoping that will make a difference ultimately at the end. We do have a very active teen pregnancy prevention initiative dealing with teen birth, so we are continuing to make progress there. We'd like to be better than Michigan. We'd like to be better than the U.S., and we'll keep working on that. Excessive drinking, I think that is something that is worked on through the Substance Abuse Prevention Council here in the community, so I know that they're keeping an eye on that. And obesity and smoking are both activities that we're looking at within the health action teams of the Health Improvement Organization. So we are working, I think, really in all of these areas already. We just need to continue to work on them, and I think we'll do well in the future. Just a quick retirement and recruitment update. Mary Riccadello, our Director of Personal and Preventive Health Services, is retiring effective June 1st. We've already initiated the recruitment process for that position, and we've updated it as well as far as the job description is concerned. We're working with County HR on that. We had a couple of state reviews during February and March. The Office of Public Health Preparedness completed a review of our S&S plan, that Strategic National Stockpile, and we had a score of 100%, and we also had a review of our Public Health Emergency Preparedness funding and administratively how we're doing there, and I think we'll be fine on both of those. We continue with leadership and communication training at the Health Department. We've been doing that since last year, and I think we've wrapped up both of our training sessions, but what we learned from it and what we're moving forward on are norms of collaboration across the organization within the team-based groups. We do have a new Health Department newsletter that we launched. A copy is in your packet, and that was another one of the items that was identified through the climate survey. Not only the county level climate survey, but we also did a follow-up survey within the Health Department, and communication continues to be one of those key areas that we need to focus on. So we thought that the staff newsletter would help get us there a little bit more along the way. The assessment of the burden of mental illness report under Allegiance Health and Health Integration has been completed, and it's been distributed within the network and some of the key stakeholders. We'll be doing follow-up meetings with key stakeholders on behavioral health in the community. There's a lot of work to do, and I'm hoping I can share that report with you next month. It is a Jackson Health Network product, so I need to get some clarification on being able to do that. I don't think there are any real surprises in it necessarily, but the numbers of persons that may be diagnosed with a given disorder in the community might be some surprise to you, because you may not have had that information presented to you that way before. So I'll do more information on that in the future. We are working on a dog bite study with Allegiance Health. The Director of Research at Allegiance Health, Al Faley, has asked us for some data related to that, so we're collaborating and helping to conduct that study. And Allegiance is really wanting to look at coming up with an estimate of the number of new cases per 1,000 residents per year. And we are hoping that we're going to see something more come out of this in terms of reporting relationships, because the ED department reports don't necessarily get reported to the health department, and the numbers that we generate through our animal bite reports, not everybody seeks an actual healthcare need through the ED. So we want to kind of work together to get the total number in the community that's occurring. We did want to celebrate a drop in the obesity prevalence among 2 to 5-year-old children in the WIC program. This was specifically information that was released by the National WIC Association. I've covered that under Health Education and Promotion, and it's a 43% decrease nationally. So we have always known that a public health nutrition program, of which WIC is, which is specific about the types of food products that are available to pregnant women and children up to age of 5, would make a difference, and I think we're beginning to see that now. So I don't think it's just the WIC program, but it's certainly worth celebrating. Teen pregnancy prevention, already talked a little bit about that, but just wanted to update real quickly. The staff organized a Power of Me fashion show that was held on Saturday, March 22nd, and it was wonderful to see the girls be able to come together and the support that the community provided to them from their families and from the community overall. It's another thing that we do to build self-esteem. Anytime we can build self-esteem, it helps really to address pregnancy prevention. Summer funding, we also were excited to learn we've received an additional amount of $15,000 for the teen outreach program, so they'll be able to continue right through the summer. Thought that was great. Environmental health, well, a quick recruitment update. We are still working to fill our sanitarian position vacancy that occurred back in, I think it was January, February. We've had some difficulty attracting candidates just at the sanitarian 2 level, so we are expanding that to be sanitarian 1 and 2, or 2 if you will, and that'll create a greater qualified pool of applicants, because we'd be able to look at somebody directly from graduating from a bachelor's program at one of the universities that offer the degree. So that's where we're going there. And this is annual food service facility licensing time in the community, so our EH staff that coordinate the food program are very busy with that, as well as our front desk staff. So that's pretty much my report. Answer any questions?
Thank you. I have a question in regard to the dog bite study.
Yes.
Of all the data that's collected, is one of the questions that you ask, are they licensed dogs?
I believe that is part of the question that's asked, and if we find that a dog is not licensed, it is required to be licensed as a process, part of that process of examining the dog and doing the quarantine function.
Okay, because I would find it interesting to see what percentages of the dogs that are actually biting and causing people to go for medical treatment are licensed.
Right.
Commissioner Shotwell?
Yep.
Are we also asking, is the dog owned by the person who was bitten?
Yes, who the owner is determined at the time of the bite. Yep.
What's when we get this done, what's our goal? What are we looking to find out?
Well, I think that it was initiated more from the Allegiance Health perspective than it wasn't necessarily from our perspective. But I think what we hope to learn is that, is there something more we can do to educate the community about how to prevent dog bites in general? I'm hoping we may get something out of that that helps us do that, but also to emphasize the importance of rabies vaccination and licensing in general. Okay. Mm-hmm. Okay. Not necessarily. But I think if the results suggest to us that we need to do something more than what we're doing, then I think we have to pay some attention to that.
Thank you. Commissioner Placzek?
Yeah, Richard, please contact me because I deal with a lot of work-related dog bites.
Okay?
So, and I'm not sure that they're never going through the ED then, they're coming straight to us, and I'm not sure that we're asking the right questions or getting that information to the health department.
Will do. Thank you.
Commissioner Lechka?
Yes. How much time are we spending on this?
We're not spending a lot of time at the health department. Our primary responsibility here was to collaborate and to provide the data that we have from the health department on the dog bites that have come to us. So really this is an Allegiance conducted study of which we're collaborating with them.
I was 2 or 3 years ago when the sheriff was collecting it. I believe, if I'm not mistaken, most of the dogs that were biting people were not licensed, and that created, and they forced them to get licensed. But I know the sheriff did something on that. Sheriff Hines was still here, so I don't, however long ago that was.
You have ferrets segregated here. Is that because you actually just got 2 of them, or on your annual report, or is that now state? Are we doing that for the state of Michigan or somebody like that, that we actually are collecting ferrets on our annual report?
We didn't specifically discuss ferrets as part of a dog bite study. Is that what you're asking? Oh. Okay.
Director Heiduck, if you'd like to step to the podium, feel free. I'm sure Health Officer Toon wouldn't mind you joining in and assisting him.
I might be able to answer that.
All right, Don.
That is just a mandatory reporting requirement by the state of Michigan. It's been on the annual report for many, many years. So we are required to take in ferrets. It's a very, very small number. So that's why it's showing up on the annual report.
Okay, and so then what are the other animals received? You have 45 of those.
Well, that is a good question, and I more than discussed that with one of my staff, as I saw that. Those often will be raccoons, basically animals that have an indication or a potential for rabies. So raccoons, possums, along those lines. Most of them are probably bats that come through the shelter, get euthanized if they have to be euthanized. A live bat would have to be euthanized. Raccoons brought in, it would have to be euthanized. You see about half of them
Item
euthanized.
7, yeah, below on both of those ferrets and other animals, what bothers me is line 7, died, stolen, escaped, or just otherwise disappeared. I just didn't want them all getting out of the building and...
Again, that's state of Michigan nomenclature. But yes, the vast majority of those animals are those brought in for potential rabies. Now, I will say we did actually have a bird for about 2 weeks until one of our clerks, it was a valuable bird. There's an interesting story behind that, but we did find a place for that bird with a veterinarian who's actually a bird person.
All right. Any other questions in regard to the Health Department report? All right. Thank you. Richard, anything else for us?
Nope, that'll do it. Thank you.
All right. Thank you. Next on the agenda, we have the Animal Shelter, Jackson County Animal Shelter's first quarterly report. That's all right. We just want to keep them moving here.
I take it there'll be no questions then. Let's see, let me get my things in order again. Well, thank you very much. I hope everybody had a nice weekend. It's been a busy quarter, I will tell you that, even though this is actually ending our slow time of the year. We are starting to fill up occasionally, and the spring tends to bring out more transfers in, people bringing in the strays and what have you. So I'd like to highlight some things over the past few months. On March 16th, we did conduct, along with Cascades Humane Society and area veterinarians, the third or fourth annual community cat project. 80 to 100 cats were actually spayed and neutered on that particular day. It is an ongoing project that occurs on a yearly basis. Dr. Missy Owens of Kibbe Animal Clinic is the one who really puts this together. The animal shelter and Cascades are the two sites that participate in this activity. And again, it's an annual event that occurs, you know, in the spring, generally in March, prior to the spring breeding season, if you will, for cats. We have had a couple construction projects over the past few months. Our dog kennel trench drains were torn up, replaced with a covered system. Sanitary infection control issues were the main things. Just makes the operations a lot more efficient for cleaning purposes on a daily basis. We would like to give a special thanks to Friends of the Animals of the Jackson area for that one. They provided a fair chunk of the funding for that project. Another construction project that occurred a couple months ago, the surgical suite and the court case kennels were being serviced by a overhead radiant gas heat tube. Dave Klein came forward, provided some HVAC contractor expertise. Along with facilities, we were able to take that radiant tube out, put a forced air furnace in place, and also extend the wall between the court case kennel area and the surgical suite up to the ceiling for sound purposes. So that, again, special thanks to Dave Klein for making that happen, for in-kind donations as well as monetary donations. So one of the main things that is currently going on, and it's not completely in place, but between facilities and us and, again, the Friends of the Animals of the Jackson area, we will be upgrading our laundry facilities to a commercial style washer and dryer. The first step of that will be a dryer that should be probably in place within a week or so. Facilities came out and took out a doorway so that we could actually bring the dryer in. So we are in that process. We've been in contact with the donator who wishes to remain anonymous, but it is being flowed through Friends of the Animals. At this point in time, the washer may be a month or 2 or 3 down the line, which is actually okay because it's actually the drying process that is the slow part of the laundry process. The reason for that delay on the washer is we want to stay with general phase 1 220 voltage versus a 3-phase situation, which we don't have, and it would take a significant infrastructure equipment cost to get a 3-phase converter. Along those lines, as you're probably getting the theme, we actually depend quite a bit on the outside community for donations, monetary, in-kind, and continuing that, I actually just got a phone call today from a concerned pet owner who is trying to arrange a golf outing to raise some funds to help the animal shelter. Now, this golf outing is currently scheduled for September 13th, so we're not going to see that for quite a long time, but I have set up a meeting next week, as a matter of fact, just to start thinking about what kinds of things might those funds be utilized for. We've also, as mentioned before, we have submitted the annual report, and just to kind of give you some idea of the numbers, I think the key thing here is our goal, along with the Humane Society, along with the rescue groups, is live outcomes. And so we do focus on the euthanasia rate, and to be blunt, we do have to euthanize animals from time to time, both for medical reasons as well during the busy time, for space reasons when we cannot find transfers out or places for them. However, I want to give you a little background. Back in, for dogs, in 2008, the euthanasia rate was 47%, and we have gotten it down over the past 2 years. In 2012, it was down to 32%. Last year, it was down to 31%, so you're starting to see that downward trend, which is a good thing. That means more live outcomes, which is the ultimate goal. For cats, 69% euthanasia rate in 2008, and has started to come down to where 2012 it was 53%, and last year we're down to about 44%. So you're starting to see that downward trend. Especially with cats, that is the emphasis, not only for the shelter, but area veterinarians, Cascades, when it comes to spaying and neutering and getting that message out. It's a long-term project, and we're starting to see some numbers to back that up. And then, as I have mentioned in the prior report, we are in the process, long-term process of reviewing our policy manual. 3 of them that have been updated and reviewed and finalized by the veterinarian and myself. Communications policy, the after-hours emergency medical care policy, and the controlled substances record keeping. They already existed, just, dotting the I's, crossing the T's, making some additional minor revisions to those. And then finally, I have met a couple times with the law enforcement community at their monthly meetings. Have discussed the issues concerning the fact that there are no ACOs, getting some input from them as well. One of the issues that I wanted to touch base with them last time, I think it was the March meeting, early March, was what kind of animal restraint equipment they actually have in the squad cars. And so that is actually going out at this point, trying to get some of that information from the law enforcement community. And along those lines, the 2 ACO trucks are actually at the animal shelter. The Sheriff's Department took their equipment out. They are now parked at and for our use at the shelter. So the cages are in there. The trucks are ready to roll when and if needed. And that's about the extent of my report. I'll be more than happy to take any additional questions at this point.
I think I'll start by following up on that last comment. Have you had the opportunity to use those vehicles?
Yes, because, as a matter of fact, a few weeks ago, one of my staff actually did have a car accident in the pickup truck. And so, unfortunately, it was a head-on. It was remnants of the snow in the road. And so that pickup truck is no more. We are not going to replace that pickup truck. We are just going to keep the ACO trucks that are which are much more functional, much more usable, user-friendly, higher capacity. It's just a better situation. So yes, we have actually used one of those trucks on a few occasions because we do transfer animals out to other organizations.
Okay, and on a follow-up on that line, have you had many calls from townships, police, law enforcement agencies within townships?
Exactly one. One. Okay. And that was actually at the last meeting, Columbia Township, or maybe it was 2 meetings ago. And by the afternoon, they had actually, their administration, their clerk, had actually found a foster home for the animal, so we actually did not even have to pick it up.
Okay. In regard to the Community Cat Project,
yes.
Very impressive use of collaborative resources within our community. Is there any expense to the county? And who's actually paying for the vaccines, or is it a donated item? Or
the vast majority is donated vaccines, donated shots, donated time. Right. Now, I did make the decision to one of my staff members, along with the veterinarian, I did pay their time on that Sunday. So I made that decision personally.
All right, thank you. Comments or questions? I guess I have one more then, as long as no one else wants to jump up. We read it quite a bit on MLive, and we had communicated also regarding the adoption policy at the
right.
animal shelter. First of all, I'd like to thank you for your efforts when constituents call us with concerns or suggestions for policies and such. You've been very accommodating to address that, so I personally want to thank you for your service in that area. How are you seeing the adoption policy at the animal shelter presently?
Well, it's still first come, first serve, existing policy. If you will remember, we had that crop of puppies come in with the mother, and we actually did a one-time, non-precedent setting random drawing of applications. That process actually worked pretty well. We were able to actually have the number of potential adopters come in, fill out the form, get some information on them, and also it created these people were energetic and they wanted to adopt, okay, rather than coming in, oh, beautiful puppy, what have you, okay, spur of the moment. So these people actually put some thought into the matter. That was a good thing, and actually once we started adopting it out, it was a very smooth process. We made the phone calls, we had the random drawing, had the phone calls, it's your turn to come in, and then eventually, right, everybody was adopted out. All puppies were adopted out, as well as the mother was actually reunited with the owner. Now the owner had lost the dog in November, could not find the dog. The dog ended up in another part of the county. The dog had puppies. During an eviction situation, the mother and the puppies were found. They were transported by law enforcement to our shelter. Through the course of this news media, MLive, what have you, the owner, who had since subsequently moved up to Grayling, got wind of the story, made contact like one or 2 days before the adoptions were going to get started, and sent pictures and verification, and we were able to reunite the owner and the dog, which was a fantastic thing. Like a feel-good story, if you will.
Better than being reunited with a sire. I thought that's where he's going to go with that, but no.
Yes. I'm sorry. Oh, yeah, she was just ecstatic that she didn't know anything about the puppies. She did not know in November that her dog was pregnant. And I'm not exactly sure of the gestation period, so, probably it was very, very early. So she was ecstatic getting her dog back. This was a 16-year-old daughter. And so the parent, uncle came down and they made the adoption, readopted their dog. So.
All right.
Well, the dogs and the puppies were in our shelter for 3 to 4 weeks. And we made a deal with her. Yes, we did. We actually, some additional vaccinations and some heartworm and some medical care. So. They were very, very happy with that. There wasn't a problem with that.
Any other comments or questions? All right, thank you for that detailed report.
You're welcome. Thank you very much.
Next, yes.
I just wanted to comment that I'm so pleased with the response the county had down there with this. I mean, these guys really went beyond the call of duty, and the outcomes were outstanding. And, you need to be applauded for that, truly, Don. Thank you very much.
All right, thank you. Next on the agenda, Administrator Controller, in conjunction with Community Action Agency, Ms. Berry, CDBG, Placemaking Plan. We are being asked to approve and send to the full board the approval of the placemaking strategy prepared by the Business Services for Community Development Block Grant allocations. I'll turn over either to Ms. Berry or the Administrator's Office.
I guess it's me. So what we have presented to you is the draft version of the place-based targeting strategy for Jackson County. This is the strategy that is inclusive for the $300,000 of community development block grant funding that we receive from the Michigan State Housing Development Authority for homeowner rehabilitation. Through the process, we worked with a contractor for MSHDA who first identified target communities that fit the criteria of MSHDA in the county. And then from those target communities, we had identified 3 county allocation communities, and those include the Village of Brooklyn, the Village of Concord, and Michigan Center. On top of the county allocation communities, those communities are those 50% of the $300,000 will need to be spent in those 3 communities. That is their targeting effort through the Michigan State Housing Development Authority. On top of the county allocation communities, we were to identify target communities. We identified the Village of Concord and the Village of Brooklyn as placemaking communities, and those communities are then opened up to use county allocation funds for things other than homeowner rehabilitation. We did originally identify the townships of Summit and Blackman to try and have some cohesion with our NSP program, but because those 2 communities don't have a mixed-use zoning policy, they were not eligible to become either county allocation communities or place-based communities.
We have an motion and support in regard to moving the strategy to the full board. Commissioner Mahoney, comments or questions?
Thank you, Madam Chair.
This is not information that we have shared with them, but we can.
Thank you. Any other questions or comments for Ms. Berry? All right, seeing none, we have a motion and we have a second to move this on to the full board. All in favor say aye. Aye. Opposed? The motion will move on to the full board. Thank you. Following along on our agenda, we have the claims of March 2014. We have a motion and support to pay these claims. All in favor say aye. Aye. Opposed? Motion passed unanimously. There are no other minutes to report. We have a May reporting schedule, Department on Aging, Health Department, Lifeways, and Medical Examiner. Moving on to the final public comment. Are there any public individuals who would like to address the board? Seeing none, we'll move on to committee member comments. Seeing none, I'll move to the call of the chair.